Hey, fools. Today, we're zooming out to look at a massive paradigm shift happening in the health sector, one that has profound implication for our culture, our well being, and the broader economic landscape. So, for decades, traditional mental health systems relied heavily on managing symptoms, but there's a growing movement backed by, serious clinical research and FDA trials pointing toward a totally different model. And it's moving fast. Just recently, Compass Pathways, which is publicly traded, tickers CMPS, saw its stock jump over 23% after announcing that its phase 3 trials for COMP 360, a psilocybin treatment, demonstrate a well-tolerated safety profile. And now they're gearing up for the FDA. So as psychedelic stocks rise on the news, my guests today argue that it's not a hype trade, but rather the kind of the birth of a brand new healthcare category. So today I have Dr. Will Derveer and Keith Kurlander, founders of the Integrative Psychiatry Institute and authors of the new book, Psychedelic Therapy, a revolutionary approach to restoring mental health and reclaiming your life. Well, Keith, welcome to the show.
Thanks. Good to be here.
Great to be with you.
Let's start right at the foundation. You argue that the recent surge in stocks like Compass Pathways isn't just a hype trade, but the birth of a brand new healthcare category. So what belief about psychedelic therapy do most people and most investors get completely wrong? And why does this misunderstanding matter?
Well, I would say that one thing investors may not know is psychedelic therapy is an interventional approach, much different than traditional psychopharm interventions, where it's not a daily intervention. This is more similar to something like TMS to treat depression, where it's like 1 to 6 or whatever amount of times. So most investors wouldn't understand that unless they went and really dove in a little bit. So that landscape is different in terms of what you're investing in. You're not investing in a drug that people are going to be taking every day of their life. You're investing in a drug that will hopefully help somebody get unstuck from resistant forms of mental health conditions, and then get to start moving on with their life. So in that sense, it's you want to look at other types of. You need to know what you're looking at in terms of if you want to look at things that mimic how these might work in terms of investing in it. Well, what would you say?
Yeah, I think that's a good start. I would add that we don't have a great track record, speaking from the perspective of a prescriber, of a psychiatrist, that's me, in terms of getting people through the mental health system and then out the door, and putting psychiatry behind them. What's exciting about this new interventional approach is that you're seeing people getting exposed to a drug, as Keith said, 1 time, 3 times, 5 times, with a durable, long-lasting benefit. And we're talking about a huge market here of treatment-resistant conditions. So, for example, when you look at just treatment-resistant depression, globally, you're looking at 100 million people who are suffering from that condition, which is 1/3 of the total people dealing with depression on the planet. So it's a big segment of the group of people who are dealing with depression who don't respond to the currently available, currently approved treatments.
Mm-hmm. Now, taking a step back, because as we're talking about this, I want to make sure that the viewers and our members understand what exactly is psychedelic therapy. What is it replacing, and then what is it doing? Is it a drug? Is it a therapy sessions? Like what does it involve if, like, let's say they were to undergo these treatments?
You want to start us off, Keith?
Sure. Yeah. Well, what it's not is taking LSD in your backyard and
That's good.
staring at the sky for 6 hours and playing Grateful Dead. Not knocking that. Many of us have been there, but it's not that, right? So it's a little different. So what it is you're combining certain medicines that are being studied, psychedelic medicines that are being studied with therapy. And that looks like the therapy has stages. So you're doing therapy prior to doing the medicine. And so you're preparing for this in many different ways. And then you have sessions typically with a therapist in the room during the sessions with on the medicine. And then you're doing work after. So you're really, these medicines are both amplifying a therapeutic process the person is going through. And then also the medicines are actually working on your brain too, biologically. And doing things there. So you get a 2-for-1 with this treatment. Whereas let's say antidepressants, which, Will kind of mentioned really briefly, those are working on your brain. You're not pairing them with therapy in the sense where that's enhancing the therapy. So this is very unique in that way.
Yeah, and another dimension of it on the neuroscience level of it is that we are opening up a person's unconscious mind in a way that ordinary therapy doesn't do, and ordinary medications doesn't do. And we're firm believers in the view, just based on the results that are coming out in these FDA trials, is that the keys to the healing often reside inside this unconscious mind that's hard to access, whether it's in therapy or with medications. So another way to say that is that we're approaching the root cause of the condition by evoking what's inside of you, as opposed to the current approach and how I was trained to medicate depression or PTSD, for example, is that you use these conventional medications you take every day to suppress your symptoms. And that might help you a lot, so there's nothing wrong with that. But when you stop taking the medications, typically sooner or later the symptoms come back. So you haven't actually dealt with the root cause that's underneath the symptoms.
Yeah, so as I've been kind of digging into this, with antidepressants, anti-anxiety medications, those are things typically patients take once a day, or
Right.
whatever frequency, different doses. What I've been reading, and clarify for me here, with the psychedelic therapy, you could be doing a treatment once, and then it opens up these pathways where you may or may not have to do more treatments, maybe every 6 months, every year, depends on, I guess, the individual. Is that how it kind of lays out?
That's exactly right. In the case of psilocybin, the research is showing 1 or 2 sessions can provide relief for 6 to 12 months.
Mm-hmm. Yeah, so that's...
Also...
Go ahead.
Yeah, you're also, Sammy, pointing out something that's an important distinction for people to understand, which is people have heard the term microdosing. Mm-hmm. Now, microdosing is not what we're talking about. Microdosing is actually more synonymous with what you talked about, Sammy, where you're trying to take a psychedelic in a very low dose with no psychedelic effect in a daily manner to see if there's a result. Now, there's not much research on this at all. But psychedelic therapy is what we call, a full clinical dose that causes the psychedelic impact. So it's in that way, it's a very different, it's sort of a different philosophy of treatment, you could say, than antidepressants.
Yeah, to some extent, as you describe it, where the people taking antidepressants, they're actually microdosing antidepressants because they are taking small amounts every day to kind of get the benefits. But if they stop taking them, then they're not going to get the benefits of those treatments. So, so kind of how do we get? You described earlier psychedelics is not taking LSD out on our lawn, listening to Grateful Dead. How do we get from that fringe counterculture of the 60s, to what was viewed of psychedelics, LSD, mushrooms, all those, to where we are today, where we're clearing phase 3 FDA trials? And what was kind of the tipping point that the medical establishment said, all right, this is actually a serious therapy?
Well,
I'll give it to you, Doctor.
Okay. I mean, one of the big issues that we see is the rates of suicide in veterans. Mm-hmm. So when you talk about how do we get to a tipping point, it's a hard argument to make to get on a soapbox and say, you know, we're taking good care of our veterans. It's hard to argue that because of how much those people are suffering when they get back from combat. Typically, we see, for example, in one VA study over the period of time from 2001 to 2014, 30,000 suicides amongst veterans, while during that time we were at war and only 7,000 people were killed in active duty. So when you have suicide rates that exceed 4 times what's happening in terms of combat deaths, that gets people's attention. And it goes to show you that we're not treating these conditions well enough. So at that point, it becomes an imperative to take, you could say, more risk, to take the risk of going outside of the dominant paradigm or the conventional mindset about how to work with these conditions.
And right now, currently, the psychedelic treatments are, what's the legal status? They're currently only legal in I believe, Colorado and Oregon and nowhere else? Or how's that? Keith, I guess I'll kick that one.
Sure. Well, we need to talk about the different medicines that are being looked at or available. So the first medicine that is largely available is ketamine. Ketamine is a Schedule III substance that's been around since the early 70s, being used in surgery and other ways in every medic's field kit for pain. In war, and then in the early 2000s, late 90s, we start to discover, at very low doses, this has a really positive impact on depression. And so it was primarily then being prescribed off-label to do this process. Sometimes it's done in an anesthesiologist's office. There's no therapy paired with it. Those can have some downsides. Obviously, you get the safety there. But then over time, more and more data kept coming out saying this is positive. Then we have a approval for a ketamine analog, Spravato. And so ketamine is widely available. It's a prescribed medication. Psilocybin, which you said Colorado and Oregon, psilocybin is still a Schedule I substance. It's the one that is basically furthest along now, I would say, in FDA trials. You mentioned Compass. They finished their phase 3 trial, getting ready for a new drug application. That would be an FDA approval that they're trying to get, which would go federal. Prior to that happening, we have the state measures where in Oregon, it's basically a personal development service. It's not a mental health service. So there's a whole infrastructure for that. It's been going on for 3-4 years now. And then in Colorado, it kind of came to market, I would say, a handful of months ago. So we have a mental health. The law in Colorado both has a mental health component and sort of a personal development component. So those are the two states. There's lots of states looking at it. New Mexico is getting geared up to get this going too now. So a lot of state measures are going to come online. And then, if you look at other drugs, MDMA got rejected by the FDA in 2024 in August, but they've been in a long process with them. Hopefully they get looked at again. And this administration is signaling they're more favorable to psychedelics. So we see what happens there. There's other drugs in trials, lots of other drugs. LSD is in phase 3. So maybe a few years from now.
Mm-hmm. Great. So, and now I want to dive into a little bit of the news cycle around, Compass Pathways that we talked about. We talked about them having great phase 3 trials. As clinicians and industry leaders, what's your reaction to this data? Does it validate the space for the broader medical community? What more needs to be done? I'll kick that one over to you, Will.
Great, thanks, Sandeep. We're bullish on it because we just see a huge need, and that the data supports that these approaches are as effective, if not more effective. They're at least as effective as currently approved models. And we think that with certain tweaks that will probably happen after approval, for example, how you are with the patient in the room and what kind of training you get and so forth, you can further optimize the results, even from what's being shown in the clinical trials, which is a common phenomenon that you see after approval with new tools like TMS, for example, when it was approved several years ago. Was essentially shown to be as equivalent to other treatments for treatment-resistant depression. And then there have been massive advances in the technology and improvements in the results that people can get from the protocols with TMS. So we think that it'll take a shape that looks a lot like that.
Mm-hmm. So whenever we get kind of an industry breakthrough like this, investors tend to flood in. It's the next hot thing, the next big thing. And this, arguably so, can become a very, very big thing. You stated some of the market potential there. When you look at kind of the suitability as an investment in this industry right now, what are kind of the red flags individual investors should be watching for? I'll kick that to you, Keith.
Well, there's different places you could be investing. Obviously, you can invest in the biopharm companies that are putting out the drugs. And that's kind of the most straightforward thing to be investing in. I mean, I think one thing is, if you're not a biopharm investor, a lot of drugs don't get through their application in phase 3, and that's just a reality. So there's that. You have to look out for that. We had a rejection from MDMA in 2024. Now, I think the positive thing that Compass is going for them is that they did their study in a very different way than the previous study was done on MDMA. The MDMA study had one component to it that is a little challenging for the FDA to understand, which is the therapy. It was a very embedded part of the actual research, whereas they really tried to look at the drug effect more so isolated in the psilocybin studies, and not look at the therapy as much. And they call it psychological support. So that's a very positive thing to be aware of. Is like there's something that the FDA is going to be able to wrap their head around a little easier for this particular medicine. And then also thinking about a lot of these kind of interventional tools. It's like, where's the service happening? There's going to be a bit of a service, kind of flourishing happening in pockets. So that is an investment. If you can get into the places that really proliferate this in the beginning, some of the healthcare systems and things that can go well too. A lot of the money to be made might be there, where the service actually costs the money. The real revenue is the $10,000, $20,000 treatment versus the $500 or $800 drug. So that's something to consider.
Yeah, and it's interesting you mentioned that because, when we look at companies, we look for kind of a moat, a competitive advantage that these companies have. Right. Traditional biopharma, they have patents, and then those last for a very long time. No one else can produce them. In this industry, where do you think, and you touched on it briefly, where do you think some of those moats or competitive advantages will be? Whether it be like synthetic patents, like, Comp 360, the clinics, the therapy protocols, where do you think that advantage will be? I'll kick it to you, Will.
Well, it's an interesting moment because as we've been talking about, Compass Pathways is ahead of the pack in terms of their trajectory toward the end of phase 3 with FDA. And we all know that getting first to market is a huge advantage competitively, right? But on the other hand, and this is kind of an interesting irony to keep thinking about and looking into, is that psilocybin, whether it's synthetic or the plant-based one, as a product, as an intervention, is a relatively long experience for the patient and the service center, the clinic, to wrap their head around. We're talking about a 5 or 6 hour experience. So, for a patient and for a clinic staffing setup, it's an all-day experience, essentially, for the patient to get that intervention. You compare that with some of the other products that are in the pipeline. that have more of a 1 hour, 2 hour, 3 hour time frame. And you start to wrap your head around, if you're somebody like me, like, you know, a psychiatrist, you're thinking, what's practical here? How many people, how many rooms do I need? How many people can I treat every day? This is where I was talking about TMS as a comparison earlier. You know, the actual treatment is 10 or 15 minutes. The session itself is under an hour. So a busy clinic could have multiple chairs. They could have, you know, several patients going through the process every day. But one of the challenges with psilocybin is going to be, how many rooms do you need? What's the footprint? Obviously, it's brick and mortar because you're going to need to have staff there to make sure people are safe and so on. So there's some practical realities to keep your eye on as an investor as these products come down the pipeline.
Mm-hmm. And, you know, so as we kind of think through the challenges also of the industry and what are some kind of the uncomfortable questions that people are avoiding asking about the business of psychedelic therapy and what we should be asking, whether we're going to be investors, whether they're going to be clinicians opening up practices and really treating people with this?
I would say one of the biggest uncomfortable questions is, how do we afford the treatment? Mm-hmm. Now, you know, if insurance companies are getting on board, that's one thing. And that will happen to some degree, but the treatment's very expensive. It's going to be $10,000 to $20,000 for these treatments. Yeah. So that is a big question of, like, in terms of scalability. A lot of people won't be able to afford, most people won't be able to afford this out of pocket. Yeah. Insurance companies, are they going to push back? What do they need to see to approve this treatment? Are they going to tell people they need to go try, 6 months more of therapy? They need to try another antidepressant first? Like, we don't know. So I'd say that's a real question around scalability of this new emerging field. I'd say that's one of the biggest factors. The other thing I would say is, and I think we're going to see some positive things with a lot of these biopharma companies, but, like, we need to make sure some of these companies haven't, they're new, they haven't brought a drug to market before, and so it's like, do they have the right leadership to do this effectively? And that's something you want to keep your eye on as an investor. Who's the leadership inside the company? Are they going to get this to the market in an effective way? I mean, that's a major factor. This is such a new drug that actually is pushing against a cultural stigma. Yeah. So, like, they need to be, solid executive leaders to get this thing to market properly.
Yeah, and I would argue that this is probably a bigger deal than when, marijuana was starting to be tested and used as, hey, it's not just a recreational drug or like a drug from the 60s or whatever. It's something that can be used to treat pain and other clinical things. I would argue, probably, for Eileen, you know better than me, that the psilocybin and the psychedelic treatments are more geared towards that depression and anxiety and all of those things rather than the marijuana. But it took some time for that to gain adoption and everyone being comfortable with that.
Absolutely. Yeah. And it is a different animal, and there's different stigmas around psychedelics than cannabis. They both have their own set. And cannabis is definitely a drug that can become a drug of abuse, much more so than psychedelics, way differently. Psychedelics are not typically a drug of abuse. Typically, ketamine is in its own class for that. It's not even necessarily thought of as a psychedelic from like a chemical perspective, but it is. But so that's different too, right? Marijuana, you're dealing with a lot of culture of, like, is this another drug of abuse? We're going to make it legal. And psychedelics is this a drug that's dangerous that will cause a psychological problem for people, not just addiction, but, like, actually, is it going to set something off in a person? That's kind of the stereotype of it, right? Mm-hmm. So we have to overcome that because if it's done well and it's, there's a lot of, good, clinical preparation and also ruling out things, then, in the research we see that mostly is not a problem mostly.
Yeah. And as you were mentioning about the insurance company, one thing I want to ask about is, if let's say they do decide, all right, we'll cover this, and then they have protocols or questions of show us the diagnosis or show us why it's needed. I'm imagining that might be difficult because anxiety, depression, all these mental health issues are somewhat hard to diagnose. It's not like, when you have cannabis, it's like, I have pain, I had a surgery, I have cancer, I have measurable pain. Versus mental health, it's like it can be abused many times. It's probably many medical clinicians that say, yeah, I think you have anxiety, here, just take this medicine and see how it goes. So getting that that, I would imagine that's going to be a hurdle. Will, I'll ask you that.
Yeah, I mean, I would just say that clinicians in the mental health field are used to a parity environment with third-party payers that leans away from ample reimbursement for mental health conditions versus, you were talking about pain and cannabis. I mean, pain is sort of considered a medical problem, not even though it has a psychological effect on people. So, being in a situation where you need to accurately diagnose and show that someone has tried and failed more than one attempt to get that condition under control is sort of a bread and butter part of running a mental health service or a clinic. But it is going to be, I think the other challenge that's hidden from sight here, we're talking about rolling out and how do you roll this out properly, is that the mental state that someone's in when they're on the dosing session, when they're in the work with the medicine on board, is so delicate. The person is suggestible, they're vulnerable. Having your phone randomly go off because you forgot to silence it during a session can have an impact that you don't want to have on a person on a psychedelic, that if you were in ordinary therapy, you just say, whoops, I forgot my ringer's on, you turn it off, no big deal. So there's a training gap here for providers. And, that's part of why Keith and I are so ferocious about the message around training and why we've trained so many people, is that you need to have a different skill set. And so that whole component of the rollout also needs to get addressed here.
Yeah, you both founded the Integrative Psychiatry Institute to kind of help train professionals. And that's going to be something, as this treatment expands and grows, it's going to be needed to have qualified, specialized therapists to kind of monitor and really, this isn't like here, take the drug, and then, you see your psychiatrist when you need a refill or something. It's
right
here, we're going to go through this treatment. There's multiple things you need to be doing, therapy beforehand, all that. So do you think the biggest bottleneck for the industry at some point will be the human element, where you need trained professionals that are really guiding properly?
It's definitely a bottleneck. The question is, will people be overeager and get people going and they don't have enough training, and then there's a little bit of a backlash? We have an insider's view. We've done almost 10,000 sessions out of our centers. And we see even, if you don't approach it with care, like you have to learn your systems and your protocols. And so there's the training of, okay, are you going to go to an institute and get trained? And then will the pharmaceutical companies require that? Likely. They have that privilege to require that. And then it's like, well, how much training is enough to really make sure we're doing this well? So I'd say it is a bottleneck. I think that definitely, the amount of providers that are ready to go is not enough right now. So once this is, legal in, every state, or, with psilocybin, and there's a big bottleneck of training we have to overcome in that initial wave. And, is that a multi-month training that's enough? Probably. But still, like, training even, thousands or tens of thousands of providers over, that they each need a multi-month training. That is a bottleneck.
Yeah, yeah. So I want to kind of help ground it for listeners. What's kind of a real world story from your that kind of captures very like heart of your argument that you make in your book? Well, I'll let you start off with that one, and maybe you both have some stories.
Well, what comes to mind right off the bat is a young combat veteran that we treated in one of our studies. I'll call him Charles. That's the name I gave him in the book. It's not his real name. And I think he was 24 when I met him, and he had done a tour in Iraq and he had a condition that we see a lot in veterans called moral injury, where it's a very specific type of trauma where the roles of engagement that the rules of conduct in the combat theater are not followed. And you bear witness to that. You see your commanding officer doing things that are inhumane or, could even be considered war crimes, for example. And your psyche doesn't know what to do with that because you joined the armed forces for the reasons that most people do, which is because you care about your country and you are there to defend and protect something that you believe in that stands behind you. Not because you have any desire to go out and kill people, right? But when, children are carrying IEDs or, luring soldiers into situations and children get killed, there can be a lasting traumatic impact from that. And the sort of nature of moral injury is that you can develop a view that your soul is irredeemable from the things that you witnessed or that you did yourself. So this particular young man went to the VA and did the things that people often do when they get home. They go and seek services, and often they get prescribed a thing called the combat cocktail, where every drug under the sun, antipsychotics, anti-anxiety, antidepressants, mood stabilizers, and so on, often in combination, with essentially no benefits. So Charles is just a good example of many of the young people who come back from war. So he decided to sign up for the study, and on the effect of MDMA, he got to have a conversation with his maker. He's a Christian young man, and got to have a conversation about his soul and presented the view inside of his state that he was in to God of, I believe I have a mark on my soul, and what does this mean? And what happens with MDMA that's very interesting is that people sometimes can access states of self-compassion and a capacity to see the events of their trauma from a sort of 30,000-foot view. And what he learned in that conversation inside of himself was that as a human being, it wasn't his role to make that judgment about his soul. Mm-hmm. He remembered and accessed the teachings of his religion, that it was up to God to decide what was going to happen to his soul. It wasn't up to him. Mm-hmm. And from there, he was able to forgive himself in what his role was and the things that he saw in combat. And he stepped into something that I want to mention because it's really important here, is that he began to see that everything that he had experienced in his life, including combat experiences, shaped him to be the person that he is today. And he reflected on, do I love who I am today? Am I acceptable as a flawed human being? Can I accept myself and my flaws? And the answer was yes. And so he began this journey into what we call post-traumatic growth, where you haven't just gotten to a place where you don't have symptoms anymore, which he did get to that point, but you're going into a place of who am I? What are my gifts and talents? And how do I give those gifts and talents to the world? So this is a really underemphasized aspect of healing from trauma, is getting to a place where now you're ready to deliver the goods of who you are in the world. Very powerful.
Yeah, and I can only imagine traditional therapy may or may not have helped him ever get to that point.
Yeah.
That's like the real game changer, is that, it's like they could have therapy, but he may have never come across that or realization.
Right.
Powerful. It's powerful stuff. And when I hear stories about it too, I'm kind of blown away by the impact it can have, the positive impact it can have. So I'm going to take a little shift here and talk a little bit. Now, you have this budding industry that could really radically change antidepressants and that pharmaceutical business model. So how is Big Pharma reacting to this? Are they fighting the FDA? Are they ignoring it? Are they buying up smaller psychedelic companies to see it as a growth area for them? How are they? They can't be taking it lightly.
I don't think they're that yet interested in it, quite frankly. And the reason is again, because it's this interventional model. It's typically used for treatment resistance when drugs are failing. So I think they still have, the lion's share of patients out there that are going to use antidepressants and other medications, and sometimes they need them. I don't honestly think this will impact that industry all that much, at least for a long time, is my guess. So I think they're not that interested yet in it, but I would say, let's see what happens in 10, 15 years if we get a number of approvals. And there is a subset of people that are like, I won't do those medications. I want something to help me get to the bottom of what I'm really dealing with, and I want to go down that road. And a subset enough of those people do that, and maybe we will start to see them get more interested. But I haven't really seen that as that they're not on the offensive so much so, and I want to hope that, and I think this is true mostly. Like, I know people in research and pharma, like, they're in it to help people. Sure, we're sure they're there to make a profit, but they want people to be helped. So I think they have their eyes on it, and is my guess, and we see where this all goes, kind of thing.
I just want to add that I think it's one of those moments where you don't want to be the first one at the party, but you also don't want to be the last one at the party. And there was a high-profile acquisition in, I think it was August of last year, when Gilgamesh was bought by AbbVie on the basis of a psychedelic compound that's called bretisilocin. And so there are these early adopters, you could say, or people who are really willing to put their to take a position, and it's a bet. The person who's there first is obviously going to take more risk, but they also have more gain potentially.
Yeah.
Right. Yeah, and there was, of course, again, Spravato. That was Big Pharma. That brought Spravato to market, which is ketamine, a ketamine analog, and that bet, I think, was a lot safer because ketamine was already been around for decades. It's not marketed as a psychedelic inside the medical space. So that was a safer bet. But that is a sign of, pharma went down that road there. So I think letting the smaller companies do more of the grassroots work of, can we get other types of psychedelics to market?
Yeah, I would imagine if they start seeing some major traction, then they'll wait. Then they'll kind of take a closer look, let them take the risk, let them spend the money first, and then if it's looking like it's something big, then they will definitely jump in. So, at the Motley Fool, as our investors, we like to look at investment ideas and industries and prospects on a 5 to 10 year timeline. Like we're very long term oriented. So we like to skate where the puck is going, as is said. So if we kind of fast forward 10 years, how did this whole idea kind of reshape the landscape, economically, culturally, personally? Are we still a little bit early to even make that prediction, or what's your take on that? Keith, I'll start with you.
Assuming we get a approval in the next 2 years, let's just assume that. Then I think we see a cascade. I don't personally think that the state-led measures will cause the type of cascade we want to see culturally. I think we need federal approvals for that. And also where we're actually impacting mental health treatment at scale. The state-led measures it's very expensive to go to market with the state-led measures, and it's they're slow, like early cannabis. So I would say 5 to 10 years, we assume we get an approval here. I think we're going to have multiple medicines in 10 years from now, probably 3 to 4 types of, maybe even 5 different, like totally subset medicines, psilocybin, MDMA, DMT, versions of DMT, LSD. We'll probably have a handful in the toolkit. I think your neighbor or, someone down the block from you all have done psychedelic therapy. It's already like someone down the block from you in many places in this country have done ketamine therapy. Mm-hmm. Not all places yet, but I think in 10 years from now, someone from down the block from you has done psychedelic therapy. And that's a big deal once that happens.
Yeah. So as we're starting to kind of wrap up here, I want to leave listeners with something they can kind of chew on, So how should the listeners listening, think differently tomorrow morning because of the conversation we're having around all of this? I'll let you start, Will.
Well, I think it's a moment to really keep your eyes peeled about developments in the space. We are at a tipping point, I think, in the next... I'm guessing the next 6 months to a year, we're going to see an approval. So once things start, there are 300 different psychedelic compounds that are currently in the FDA process, counting from state, phase 1, phase 2, and phase 3 studies. So it's like the cannons are loaded and nothing's been shut out yet. So it's a time to really pay attention. I would say that these analogs that we're seeing that are a little bit behind Compass pathways, that have a shorter duration, are very interesting, just from a more practical standpoint for the rollout. But I do think that the reimbursement issue is going to be a significant factor for rollout. We saw that previously with TMS 10, 12 years ago. And we've also saw it with Spravato, which now, as of this past year, is a blockbuster for Johnson & Johnson. I think they had something like $1.2 billion in sales at this point for Spravato. So, but it took a while for Spravato to get reimbursed. It took a while for clinics to adapt to this 2-hour time frame that people have to be there. So I think it's a good time for people to be paying attention to the next developments.
So what is kind of, as you're writing this book, what is something that totally changed your own thinking around this area, Keith?
Well, I came from a perspective early on of like, can psychedelics be done safely in a repeated way? Can we do it? I'm talking decades ago is where I came from. And I had a big question about that based on personal experience. And then over time, I had a lot of clients coming to me way before psychedelic therapy was the thing, just like had a psychedelic experience and a whole bunch of stuff came up and we don't know what happened. Why was it so hard? And so I would say that the process of getting involved with psychedelic therapy and then with Will and our institute and I've come to really see that this is a safe enough treatment. We need it now, because if it's done in the protocols that have been developed now with a lot of care and precision by a lot of people that had the same question as me in their head, and they want it to be done safely, that, we now have enough research to show it can be done. So I would say that over a long period of time, my understanding of these medicines have changed greatly, and that I'm a really big believer that they are a very important tool that we need to get at scale to the public right now, because the rates of mental illness are just disastrous on this planet right now, and you see it hockey stick as with the younger people. So we need another tool right now. Mm-hmm. So I'm hopeful, and the process of writing the book was a nice process of kind of really exploring that.
And I'll ask you, if someone's listening today that never reads the book, what is one idea that they hope they walk away with? And I'll leave that for both of you to answer. So Will, if we start.
I think it starts with the view that we talk about a little bit in the book that I've held for a long time, is that anyone can heal given the right supports. The example I used earlier of Charles going to the VA and trying to get a result and not getting the benefits from conventional care approaches illustrates the point that when you have the right supports, you can not only put your mental illness in remission, but you can also grow out of it and become a really productive contributor to society. So most of mental health care is really just oriented toward eliminating the symptoms. It sort of stops at that point. And what we're here to say, and what I think psychedelic therapy done well represents, is the opportunity to not just eliminate symptoms, but to be more well than you were before you encountered these troubles in the first place.
Mm-hmm. And Keith?
I'd piggyback on what Will is saying, that we have been fed a lot of information from the medical establishment, again, not with malintention, and also culturally about what mental illness is and what mental health is. What's depression? What is this thing? Depression, anxiety, there's a lot of just stereotypes about this stuff out there. And it's sort of like, I think a lot of people feel like, I've inherited this, or there's not a lot I can do about it on some level. I have some symptoms I need to get rid of. And I would say that there are actually known causes that are having these symptoms are actually signals in your body that you just got to go understand how these signals work to go address the cause. And once you do that, you get well. So I would say that people need a re-education. Not everyone, but a lot of people do, to just understand, like, where do these things come from? Why are so many people struggling? Why is 1 in 2 people, have had a pretty significant mental health illness in their life? Why does that happen? And then how do you solve it? So once you have that knowledge, this kind of, elephant in the room can start to go away, I think, and we can start to get more well.
Yeah. Great. Well, that's a perfect place to leave it, and the book, again, is Psychedelic Therapy, Revolutionary Approach to Restoring Mental Health and Reclaiming Your Life. I believe it starts selling on Amazon tomorrow. Is that correct?
That's correct. Yeah.
Great timing here for the book. So
yes.
Thank you, Will and Keith, for joining us today and exploring this topic.
Thanks so much.
Thanks, Sanmeet. Great to be with you.